Hi, my name is Amy Rodriguez, and this is my informative speech. March 30th, 2013, my grandmother passed away alone in her apartment due to a heart attack. One of the reasons that was the cause of her death was the fact that she had stopped taking her medications. My goal of this speech is to inform as many about different kind of cardiovascular diseases, the causes, the symptoms, and the treatments. Cardiovascular disease is the number one killer in the United States. To be informed, I believe, is a key to prevention. The three cardiovascular diseases that I'm going to be sharing with you guys is high blood pressure, coronary artery disease, and peripheral artery disease. So I'm going to go ahead and begin with high blood pressure. High blood pressure, we ask, what is high blood pressure? High blood pressure is hypertension. The normal high blood pressure is 120/80. Anything that is over 120/80 is already under the category of hypertension. Hypertension is something that affects millions. Now, there are different symptoms. It depends and it varies to each person, to each individual. The different effects can be headaches, can be dizziness, can be as severe as stroke and a heart attack. Now, the kind of treatments that they have for high blood pressure are: one is self-care. Self-care falls under exercising, which exercising is very important to be done preferably 5 days in a week, 20 to 30 minutes. Another self-care is also a healthy diet, which means less salt to no salt. And if with self-care it's not sufficient, then it would definitely have to fall into the category of a diuretic, which would be pills. Pills can be lisinopril, which is a very common medication that is given. Now, there are different strengths, and it can be 5 milligrams to 10 milligrams. It just depends on the strength that better suits you to make sure that hypertension is controlled. Now, this is something that can last long, but at the same time, it can be something that can go away as long as the proper attention is taken, and it can be avoided. But make sure that if you do have hypertension and you have high blood pressure, that you do give it attention and that it's treated properly. Now I'm going to be going to the next topic, which would be coronary artery disease. Coronary artery disease, we ask, what is coronary artery disease? It's the damage of the heart blood flow to your vessels. Now, how does this happen? It's a build of plaque. Now, the build of plaque, what causes buildup of plaque is cholesterol, and the causes of cholesterol can be fatty foods, can be smoking, and no exercising. Now, so you guys have an idea, there are many symptoms that they go in different ranges. It can be as a range as no symptoms, it can be chest pain, and it can be as critical as a heart attack. Now, what are the types of treatments? It's also self-care, and that would be a healthy diet, low in salt, no salt, exercising 5 days in a week, 20 to 30 minutes preferably. Now, you can go into the diuretics, which would be blood thinners. It can be other kinds of medications, along with surgery. Now, going a little over surgery, the way that this is done is by a stent being placed in the blood flow. So what happens is that you have plaque that builds up. So when the plaque that builds up, you're going to have a stent that is going to go in. So the plaque is, let's say that this is a blood vessel. So let's say half of this or all of this is closed up with plaque. So what happens, they put a stent, so the stent is going to go in, open that blood vessel so that the blood is going to keep, going through to pump blood to where it needs to go to keep the heart moving. Now, This is something that cannot be cured, but it could definitely be treated. So it's important that if you do have coronary artery disease, that the proper attention is given and that it's taken care of properly. And with that being said, I'm going to be moving on to peripheral artery disease. Peripheral artery disease is also known as peripheral vascular disease. Now, this is a disease that many have, and they don't even know that they have it, or they just think that it's something that, oh, I have leg pain. But just so you have an idea of what peripheral vascular disease is, it's the arteries that carry blood to our head, organs, and limbs. So this is also a cause of a buildup of plaque. And as we know, as I just mentioned earlier, that plaque is due to cholesterol, to a buildup of cholesterol or high cholesterol. Now, this can be a cause of no circulation in the legs. This can also cause cramps in the legs. Now, it can go as far as a patient having no circulation going down to their legs. That can then cause something more serious as gangrene, which, if this is not taken care of properly, then this can cause this can be as severe as an amputation. Now, what are the risk factors? The risk factors are aging, diabetes, and smoking. What are symptoms? Leg pain. Now, the treatments for peripheral arterial disease would be blood thinners. It would be stop smoking if you are, a smoker. Exercise, a healthy diet, and surgery. Surgery is the same way. If you have plaque that is building up in the blood vessel, it's the same way. You're going to get a stent. They're going to place the stent in the artery so they can go ahead and open that artery again so there's blood flow and there's circulation to prevent cramps and also to prevent gangrene. And with that being said, I just want to go over the 3 topics. So we went over high blood pressure, we went over coronary arterial disease, and we went over peripheral arterial disease. These are the three main cardiovascular diseases that I have discussed. Now, with that being said, I want to let everybody know that this is one of the leading, these are of the many leading causes of death for both men and women in the United States. And this is something that can definitely be prevented and treated. And I definitely think that this is something important for everybody to be aware of and to know of, so like that they can avoid future dramatic experiences. Now, with my closing statement, I want to ask you guys, what will you do to prevent and lower your risk of cardiovascular diseases? Thank you.